Cool. Hey everybody, Joe Stofker here, and today we're talking with Charles Frohman. He's going over some healthcare alternatives that people like me are not aware of, and so here we are today, and he's going to educate us.
Well, thanks, Joe, and it's a privilege to have this opportunity because you and I know each other from some activism days, and healthcare is such a garbled market that it's a good place for an activist to try to fix some things in healthcare and give folks a better deal. And this company has a plan called Health Excellence Plus that I think a lot of folks are going to like. If you want me to kind of take you through a couple slides.
Yeah, please.
So what I titled this was Patient Empowerment equals Healer Innovation. In other words, we're going to empower families, patients with this plan, and we're going to allow healers, doctors, chiropractors, naturopaths, a chance to innovate. And that's one thing we found in this venture is that the doctors and healers are as dissatisfied with this market as much as their local family or realtor or small business. And
so if I can interject, so you're saying that this is from a political standpoint of making change in our world, since we brought up the activism days, this is kind of a dual approach of the practitioner being able to participate in creating change, and the family buyer, consumer, people looking for assurance in their health, they can, make decisions with their wallet that change this ecosystem.
Exactly. As any family or practitioner will discover in this discussion you and I are having, this is a great opportunity to get more choices that you want in healthcare and leave behind some of the frustrations. So it's a pretty good experience to talk to folks about this.
Cool. I'm excited to learn more. Keep going. Sorry.
No problem. Ask away anytime. So the next line in my slide here says, buying better health plan, fixing broken market. This health plan is going to help you fix the health market that most of us complain about. And the link right there, Health Excellence Plus, is where you can go to learn about this plan. Now, in putting together this plan, we try to come up with what we see as the 6 big problems of healthcare. The first one, everyone can agree about. The premiums you pay rise every year. It's an endlessly rising cost loop. It's horrific. So what we're going to talk about today solves that. Our prices haven't changed in years. Stable prices are really a great thing. The next problem we have found in healthcare are the lack of incentives for patients. With health savings accounts and other provisions, we give our families and small businesses an incentive to make some money actually through careful shopping of healthcare, which is really a great provision. Third, folks with their usual insurance plans find that there are networks that tell you can't see certain doctors. Well, we did away with networks. And as we'll discuss in a second, there's a way we work things so that you can have choice. Locally, type of care, location, internationally, we restore choice. No networks. Fourth, a big problem as you are forced in some cases to find new doctors because the recent law took away your doctor, are the loss of records. So you see your new doctor and you don't have your medical records. We have a part of our plan that puts all your records right on your card or a key fob. That centralization really empowers you and your doctor to know what's going on. The last 2 problems deal with lost time finding a doctor or sitting around in waiting rooms. And the final one is the lack of personalization. Healthcare is not standard for everyone. You have unique needs, and we really facilitate addressing that personalization that you want. And we'll discuss that in a second. Do you have any questions from that slide, Joe?
No.
So the three big changes in our plan that put you back in control are the use of what's called, first, medical cost sharing. This is not insurance, but millions have left in another market banks for credit unions, and no one worries about that. When you go into a credit union, it looks like a bank. You can't tell the difference. The service is great. When you use medical cost sharing, as millions have done, they can't tell the difference. You have a monthly bill, and you have this company paying for your medical bills. And it costs a lot less, and it's great service. So open your mind to wondering, why shouldn't you get better services and prices too? The second change we make are the incentives we give you to become a careful shopper of healthcare. With a health savings account, not only do you get pre-tax money for healthcare, but you also get the ability to save up every year for retirement. You could have thousands of dollars in an HSA by the time you retire. So this plan saves you money, and it allows you to earn money. The third thing is, the way to give you choice of doctor or treatment is to do away with networks and to make you a cash payer. That's the big paradigm shift we're talking about here. Self-pay patients get to choose any doc, any treatment, even natural care, even medical tourism overseas. You're paying cash, and no one says no to cash. And I have a little visual here on the next page that kind of explains this three-part paradigm shift that we're giving families and small businesses and the doctors who work with us. For the expensive stuff, the cancers, the heart attacks, the car accidents, up top, we use medical cost sharing instead of insurance. It works the same, it's just cheaper. And on the left part of this triangle, HSAs. That's what empowers you as a cash shopper. You can build that thing until you retire in the thousands of dollars. And the third rung of this triangle is choice. Using sharing and HSAs, you become a cash payer. There's no limit, so you can go see.
So real quick, so for people who maybe might not be familiar with HSAs, do you want to just explain that real quick?
Yes. So there are a lot of articles in financial blogs like Yahoo Finance and elsewhere. Financial planners are suggesting not using an IRA or a 401k, but rather an HSA, a health savings account. Why are financial planners saying that? Because these things have triple tax benefits. From your income, whatever you contribute to a health savings account reduces your taxable income. It's called pre-tax. Any interest the bank pays your HSA is tax-free. It rolls over annually, so it builds up every year with interest. Any withdrawals from an HSA that you make for healthcare are not taxed. When you retire, you could use HSA funds for any kind of expense, including health. And there are articles galore how Medicare does not make you whole on healthcare. You will have a lot of out-of-pocket surprises when you retire. So HSAs are a great vehicle for paying your urgent care visits, glasses, hearing aids, supplements, maintenance medications, your visits to your chiropractor. They're great for your ongoing low-level regular health expenses, but they're also good for retirement. HSAs are great.
So it's really a financial vehicle as much as it is healthcare.
It definitely is. It's there to build up tax-free for healthcare, but if you build it up every year until you retire, it's a retirement vehicle with lots of tax benefits. So we're the only sharing plan in the country that allows for HSAs. And with the out-of-pocket options we have, you'll find out that we are the lowest out-of-pocket option in the country for HSAs. This is the best HSA plan out there.
Cool. Keep going. Thank you.
Sure. So with us, you can choose your out-of-pocket from $500 to $5,000. That's per sickness or accident. So there are ways with us to reduce your out-of-pocket down to $500 per sickness or accident. And that means your out-of-pocket is real low. And that's something most folks don't have right now. Because of the recent law for healthcare, most people have out-of-pockets, deductibles, copays over $1,000, sometimes many thousands of dollars. So right away with us, you can reduce your out-of-pocket down to $500. Second, you can pay less per month and build your HSAs we just discussed, or another account vehicle we offer called health matching accounts. And that is basically a supplemental policy that can build to tens of thousands of dollars that allows you to take a higher out-of-pocket and pay less monthly. So if you really want to reduce your monthly fee with us, these two vehicles, HSAs or HMAs, are the way to do that. And we can discuss the details later. But just know that we have ways to save you money, whether you need to pay less per month or what have you. The third service we give to reduce your out-of-pocket, and this screen is about out-of-pocket expenses with us, is we give you the required preventive screenings under the Affordable Care Act for free. And that is with a network. That's the only part of our plan where we do choose a doctor from a network. But that's just because these are free screenings. There are 70 screenings with your blood and whatnot, mammograms, colonoscopies, wellness visits for your kid. These are free within a network. And then if you do need a doctor for a sickness or an accident, we give you Teladoc for free. And that's where you call on the phone, hi doc, or Skype online. I feel horrible and they can diagnose you, they can give you prescriptions, that's free. The prescriptions you get from that visit with the Teladoc aren't going to be free, but the discussion with the Teladoc is free. Fourth, if you have maintenance meds that you're paying for every month, or you have a MRI that your doctor wants you to go see, or some x-rays, or you need to see a specialist, we have a concierge. We're making you into a cash payer, but we're not going to release you in the jungle of healthcare alone. There's going to be 1-800 number to call whenever you have a health problem. We're going to shop for you. If you have an expensive maintenance med, we're going to find you a more affordable generic overseas with the pharmacies we work with in New Zealand, Canada, what have you. We'll find you an affordable drug if you're overpaying. Same with MRIs. Right now, folks know that you don't want to go get the MRI in the same hospital. There are standalone testing centers now, MRIs, x-rays, and there's more coming up. That's where you save money. We'll help you shop and find ways to cut your out-of-pocket expenses. Specialists, medical tourism is hot now. There are surgery centers nationwide that disclose their prices. There are great top-level centers opening up right outside our borders in Mexico and Canada. So
this is really driving true cost economics.
It is. The biggest problem in healthcare is a lack of prices. By having our members ask for prices, we're helping disgorge those prices, and then you're going to shop around using price as well as quality. But price is an important thing to disclose to fix the market, and a lot of people like what we're doing because we're creating the cash payers that are going to facilitate the shopping necessary to get more prices disclosed.
So that's why alternative practitioners, that's a side where they like this just as much, as because they obviously are already working with cash payers.
Functional practitioners and allopathic. We work heavily with DPCs. A lot of doctors are sick of Blue Cross and Medicare, third-party payers interfering with their practice. They have to spend all their time with you entering data in electronic records. They're starting to charge you monthly fees for what are called DPC, direct primary care arrangements, where it's a good deal. You get a lot of low cost or free preventive primary care. And so we work with them. We complement them as the catastrophic payer for their patients. And so, yeah, it doesn't matter if you're functional, integrated, allopath, all of the doctors want cash payers, and we're the company that creates them. So we're a great complement to all types of doctors and chiropractors and functional medicine providers. And the fourth thing for the higher drug or visit needs, the direct primary care, DPC, I just mentioned, that is something that we complement well. We have a very affordable catastrophic plan that meshes with direct primary care. If you're already paying a monthly fee to your primary care doctor for low-level primary needs, then we have the complement to protect you for the cancers, the heart attacks, and car accidents that your primary doctor is not going to cover. And that goes with functional practitioners as well. It doesn't matter. So, and we also have the copay type plans that you're used to. If you don't want an HSA, we have a copay plan if you want to start off with that. And we have a personalized plan. There is an online Teladoc option that we have, not an HSA, but it'll pay for free, unlimited primary care visits or chiropractor visits with this Teladoc type company that we work with. So if you know you're going to have a big need for more doctor visits in the upcoming year, we can work with you on that plan. So we have a variety of plans based on the needs of the patient. That's why I mentioned personalized care. We really give you what you need. HSAs is the best, but you may want the copay plan for more higher needs with doctors and specialists, or the personalized care plan to have zero copay, unlimited visits with a chiropractor or a primary care physician. We have options. And finally, we have a discount dental plan that we could add, $40 a month to your major medical plan with us. Does that make sense? This is all about how we're going to reduce your out-of-pocket.
Yep. And for like an individual who would be listening to this, for them to figure that out, that's just where everybody's different individuals, so they get together and talk through this with someone.
Yeah, I'm going to start you off with the HSA plan so you can have the full consumer empowerment opportunity. But if we discover that you have some pre-existing conditions that might need some higher utilization of care, well, we could talk about the copay option or the online Teladoc personalized option for zero copay visits. So we will help you wherever you are in your healthcare plan or path. So what we're selling is the healthy care strategy, because it's not about Blue Cross or sharing or any kind of perfect plan, perfect company. It's about what different services can we combine to give you what you need. And we've come up with a 5-part strategy. Let's start with number 5. Let's start with number 1 and go up, since it's numerical. First, our first strategy point is avoid. If you want to become a responsible healthcare consumer, which is what we're seeking and which is what you want to be if you're going to be a shopper of healthcare, you want to do what you need to avoid the doctor. So we have a self-assessment that you start off with. You figure out where you are with your behaviors and what you need to boost your nutrition or exercise, good habits to be healthy. And we have services like coaching or an online forum to help you be that healthy consumer. That's the first part of our strategy. Let's find out through an assessment where you are health-wise, and so you can stay out of the health system and be healthy. The second part of our strategy is prevention. We'll give you the free checkups and the free screenings. That way you can know what problem is coming down the pike if you don't get treatment that you need. That's prevention. The third part of our strategy is managing health costs and incidents when they come up. If you get sick or have an accident. That's where the health savings account comes in. That's going to help you use a tax code to write off expenses to manage these costs. That's where DPC comes in, direct primary care, or a monthly fee with a naturopath, a chiropractor. These are ways to manage your ongoing low-level expenses. And we have the personalized option I mentioned with the online Teladoc, or the copay option. These are ways to get your tests and to minimize your costs when they come up, to manage your costs. Fourth, we call it mitigate. If you have maintenance drugs that you can't avoid, we have a concierge that's going to hold your hand and shop for you. We're going to find you affordable drugs. We're going to find you affordable MRIs and x-rays. We're going to find you affordable docs that disclose their prices somewhere else in your state or outside the country, or a specialist in your area that have good prices. We'll help you find what you need. Finally, when you have major medical issues from a sickness or an accident, we use what's called medical cost sharing, a community of like-minded individuals to pay those bills when they get expensive, whether it's above $500 or above $5,000. You're going to choose your out-of-pocket with us. And when those expenses exceed that amount, we use a medical cost sharing service to pay those bills, and it works great. You're going to love how it works. So that's our strategy, and that's what we're selling. So, Joe, there are limits to our plan, as there are for any plan, and people need to understand that going in. Number one is a pre-existing waiting period, which is tolerable for most. Most folks understand that their pre-existing condition probably won't flare up in that first year, where we're not going to pay for expensive episodes of that pre-existing condition. Because our monthly fees are so good, you're going to want to work with our concierge to help you shop for whatever you need during that waiting period. But if you are a cancer patient, probably this is not the plan for you, because it's hard to afford cancer drugs in that first year of waiting. So we won't refuse anyone, but we will make you wait a year for any symptom you've had over the past 3 years.
And you could use both your existing insurance while you're during this pre-existing time period?
For sure. If you're already paying $2,000 a month for your health care, and if we're just going to charge you a few $100s a month, yeah, add us and keep your previous insurance for a year, and then you'll be good to go. It's a great strategy, Joe. Good thinking. And so the second point, we weren't sharing new cancers caused by previous cancers, but actually as we grow and we're 5 years old and we perfect our math, we're actually not limiting that cancer anymore. So good news. And a lot of past cancer patients are very excited that we will share in cancer expenses that are caused by previous cancers going forward. So every company improves, and that is something that I will delete from this PowerPoint going forward, because past cancer patients now can join us with confidence that this limitation no longer applies, which is powerful. It shows you what happens when a market grows. There is a surcharge, number 3, for smokers. You will pay $50 more a month with us, and if you're over 50 and have an expensive disease that is caused by smoking, like COPD and others, we won't share in those expenses. So if you're a smoker, you can join us, but just work with us on coaching to quit your smoking so that you won't face these limits when you get past the age of 50. Number 4, on maintenance meds, I have mentioned our concierge is helping you shop for more affordable alternatives overseas. And that's because 4 months after you're cured from some horrible disease or accident, we'll pay for the sharing. We'll share on those expensive drugs for 4 months, and then after that, those drugs, after you're cured, are termed what we call maintenance meds. And at that point, we're going to shop for you for those drugs to find affordable alternatives, but you're going to pay for them out of your HSA. The 5th and final limit is our out-of-pocket is not a deductible that resets every year. It's an out-of-pocket per episode. So it doesn't reset annually, which is good. In other words, and it extends for however many years your disease remains. So let's give an example. Chances are, if you have a serious disease like cancer or heart problems, that could go on for years. So that's better with our plan, because once you pay your $500 or up to $5,000 for that episode, you're done, no matter how long it lasts, years. There is no upper limit with us. With insurance, your out-of-pocket resets every year. So you owe that $2,000 or $5,000 for that heart issue or cancer issue every year with insurance, not with us. But what that does mean with us is that you're going to pay for everything, every sickness or accident up to that $500 or $5,000 level, no matter how many episodes you have. up to 3 per year. So if you have, with us, cancer in the same year as a heart attack or a car accident, you'll pay your out-of-pocket, whether it's 500 or 5,000, 3 times. And then after that, you have no out-of-pocket. So on that 4th serious episode where it passes your out-of-pocket of 500 or 5,000, we'll pay starting on the first dollar, if that makes sense. So the good news is that, we're really a catastrophic plan type arrangement where you're going to pay the first amount of dollars with the HSA for everything up to 500, and then we'll pay for everything above that. And if you have, a bad year where you have 3 terrible expenses, then we'll protect you after that. But you got to think of odds. What are the odds of you having 3 expensive episodes in the same year? It's 1.5 on average. In other words, you'll have 1, maybe 2 episodes that go past $500 or $5,000 in a year. For most people, that won't happen. But if they do, we'll limit your out-of-pocket to 3 episodes. So that's how that works. And the good news is it's not deductible, so it won't reset. So however long your expense of sickness lasts, you're protected. You've paid your portion, that's it, no matter how many years it lasts. And if you're cured and your sickness comes back before a 12-month period goes through, that's considered the same sickness. So you still have no out-of-pocket for those long-term illnesses with us. That's a very popular service.
I was like, that's just pretty amazing for most people and how they've been starting over with their, deductibles and everything every year, basically, right? That's got to be huge for your company.
It is huge. There's no surprise deductible resetting every year. And as a true catastrophic company, when your disease or accident goes beyond a year, you've paid your portion, you're done. And our concierge is going to continue helping you shop for affordable alternatives as a cash payer. So yeah, a lot of executives especially like this plan because they love the power it gives them for choice. So in sum, cash paying gives you choices, whether allopathic, natural, or tourism worldwide. People like that power. Number 2, doctors love this, or naturopaths, because cash paying restores your time with the patient. There's no more codes. There's no more third-party interference. This is you disclosing prices and working with your patients, no matter how much time you need. Cash paying restores time with patients. Doctors love this. Number 3, cash paying puts you in control. We have a political arm called the Health Freedom Hub because we want to advocate for even more choices. Despite the choices we give you, there are a lot of limits on the choices out there, and we work with politicians to open up those choices. And as a personal responsible patient, we want you to join our cause. We want to give you more choices. 4th, our company is dependable with over 10,000 family, business, and association members since incorporation in 2013, and we're quickly arriving at 20,000 members. And our attrition rate is near 0. Because to leave us would imply that you want to pay twice as much to access the same doctors. Once you join, no one leaves. In conclusion, we have, these are the 5 plans in more detail that, we can kind of review later for individuals that want to talk to me or you about the plan. From least expensive to more expensive, we have the catastrophic plan, number 1. And then plans that combine with doctors, DPC, or naturopath. The health savings account plan is the next most affordable plan. And then the last 2 plans are the high-touch provider-directed plan that with 0 copay visits. And then the copay plan most folks are used to is the most expensive one. And so I think, Joe, we might want to leave it at there. And these are partners that we have, and I do need to run.
Yeah, it's like you sound like you got a crisis going on there. Well, thank you for taking the time to explain all of this. I appreciate it.
Yeah, why don't you turn off the recording?